Hi, my name is Julie Weissert. I am a UNF graduate dietetic student, and this is my community assessment for spring 2025. My community assessment is on Deltona, Florida. I chose this location because I work for WIC for Volusia County. I'm a WIC nutrition educator for Volusia County, and I work in the Orange City. Volusia County is divided into an Orange City clinic and then a Daytona Beach, Florida clinic. So again, I work in the Orange City, and Deltona has the top two zip codes of WIC participants in my area, actually. So it's the top two zip codes with the most participants in the WIC office for Orange City, Florida. And here's just a chart. We have over 4,000 participants in Orange City. And here's a chart. You will see that 32738 and 32725. I only listed the top 8 zip codes in Orange City because there were a lot for Volusia County in our area. But I only listed the top 8, and you'll see with the graph that the 38 and the 25 are the two most popular. And again, both those zip codes are in Deltona, Florida. The goal of this assessment is to assess the community in which I provide nutrition education and counseling to better understand my participants' social and physical barriers to well-being so that I may better cater my assessments and education and counseling to their unique and specific needs. There are several objectives in this assessment. First, explain community demographics as compared to state and national demographics by researching online government databases. Discover and list community assets available to residents for healthy meals to include access and financial affordability for nutritious foods by exploring the built environment itself. Describe communities' availability to healthcare services, retail stores, schools, libraries, and other government agencies, and transportation by exploring online databases and built environment. Online environmental factors to promote physical activity by exploring built environment, and catalog and identify available community resources for community by exploring government databases and exploring built community. Now on to our community assessment. First, we will explore what I have found online through governmental databases to find out more about the community. First, we will explore population size. As you can see, starting from the left and moving to the right, we have Deltona, and then the Florida, and then the United States. And Deltona makes up 0.03% of the population. It has about a little over almost 99,000 people in its area. Okay, demographics. As you can see, Deltona is actually about pretty close with race, white, and then Hispanic and Latino are pretty much neck and neck. Um, if you look at the state of Florida, there's a little more white than Hispanic. And then if you move on to the nation, there is way more white than Hispanic. But that should tell you about half the WIC participants that I see are Hispanic. Most speak English though. But you can tell with Deltona is pretty much half Hispanic, half white, and then we are followed up by African American and then Asian. But those look pretty par on course for the state of Florida and for the nation. But I find it interesting how Deltona is half and half, but as you move from Florida into the nation, the demographics change. We do get here in Florida, we do get a lot of transplants. We have a lot of Venezuelans, Colombians, we have a lot of Puerto Ricans. So we have a good variety of people here. As far as gender, we're almost, Deltona is almost 50-50. We do have slightly bit more women than we do men, but that also is on par for the state of Florida and for the nation. I think we all know the demographics of women have been more than men for quite a while now. But what's interesting is I've seen a lot of babies in the WIC clinic lately, and I've been seeing more boys. So I'm interested to see in a few years how this trend's going to change. Religion. These demographics were actually really hard to find from reliable sources, but it's interesting all the same. Deltona is right in the middle and it's so tiny, but you can see Christians are actually the highest number. It's that little tiny bar that sticks out the most. So Deltona has the highest number of Christians and then actually followed by no religion. And then if you look at the state of Florida, no religion by far exceeds any other religion. So Deltona is probably on par for the state of Florida in that they don't identify with any religion. I know a lot of people that I talk are either Christians or Catholics, and that's again in like Seminole County and Volusia County, just kind of surrounding counties. For the United States as a whole, actually, most are Protestant, and then it's again followed by the no religion, unaffiliated. I think it's interesting. A lot of people probably don't want to identify, and there's also a lot of churches now that are non-denominational. So I wonder how many people don't classify as that. That I don't know. That is a whole nother conversation. But again, Deltona is probably close to Florida for being unaffiliated with the religion, and then it would be number two in the nation. Languages. English and Spanish are pretty much dominant across every board in Deltona, Florida, and the U.S. Obviously, English is the primary language, but Spanish, compared to the number of people that live in Deltona, is about 50%. For Florida, Spanish is about 30%, and then in the United States, it's about 17%. So it's really interesting. It goes back to our population size and our demographics in general, is that Deltona is very Hispanic populated, and it's no surprise that Spanish is the second language at a 50% rate compared to the overall number of people that live there. Average life expectancy in Deltona is about 76 years old, and median age in the area for Deltona is 39. Florida's 42, and then the US is 39. So it's pretty interesting why the state of Florida overall has a higher age. I think it's probably contributable to the snowbirds that come. But Deltona is right on par for the US with a medium age of 39. The average family size for Deltona is slightly higher than that of Florida and the US. The US and Florida are 2.5 and Deltona is 3. So it's like an average of half a person more. I do think a lot of people have a lot of large families around there. I went to a park at the end, and even when people come in the clinic, they have honestly, a lot of them have about 3 kids. I feel like this is pretty on par for the WIC participants that I do see in the clinic. Most of these are married couples. You also have male household, female households, and then just non-gender. So again, Deltona is about 3, which is a little higher than the Florida and the US for average family size. Income, employment, and job market. This graph is a little weird, but it was the best way to kind of show you numbers. Not in the labor force is people because they're underage. They're not able to work yet. Most of these numbers are 18 and above. Deltona, Florida, and the nation are pretty much on par with all the numbers as compared to employment, unemployment, armed forces, and again, not in the labor force because of age. I did look up an unemployment rate that's current as of today. So Deltona is at a 3.8. Usually they run like a 5.8. So they're down like 2% for the unemployment numbers right now. And I also think that has to do with Florida, as a lot of people know, is a very seasonal state. People come and they go to Disney, they go to the beaches, they do a lot of fun stuff here, and we're getting into that season. So it makes a lot of sense that the numbers are down right now. The slower months like January, February, September, and October, my guess is the unemployment rates for Deltona and Central Florida are higher because people aren't coming and there's no need for people to work. The state of Florida is currently at a 3.5 as compared to the nation that is at a 4.1 unemployment rate right now. So Deltona is kind of right in the middle from Florida and the nation for the unemployment rate. I did stick the job industry market here because I thought it was pretty interesting. It's the number one demographic for jobs in Deltona is educational services and healthcare. There are healthcare is really big here. There are lots of HCA, Orlando Health, Advent Health. There's a lot of big employers. Halifax, which we'll talk about later, and then there's professional, scientific, and then you will see art, entertainment, and recreation is kind of up there as well, which makes sense because again, we have a lot of beaches, parks, lakes. I mean, Florida is climbing with the water, so we have a lot of great things that people come to Central Florida for, and it's kind of seen right here in this job market portfolio. Median annual income, Deltona is around 71,000, with the state of Florida at 73, and the United States at 77. So as you can see, Florida is under for the annual median income, and Daytona is even lower compared to the whole U.S. Deltona is down about 6 grand, and that's a pretty big difference, and that would explain some of the resources that are needed in this area. Education wise, Deltona is pretty much on par compared to the state of Florida and to the nation. For Deltona, compared to the population, about 21% have at least a high school diploma, they're high school graduates, and about 25% have an associate's degree. It drops down a little lower at the bachelor's and the master's level, but I do talk to a lot of people that are like teachers, nurses, paraprofessionals, that kind of thing. So the associate's level is pretty on par. I do have a lot of people that are like me and they're also going back to school at my age. So I think the statistics are slowly changing. And that's one thing that COVID did that's really great. It gave a lot of online resources for people to continue their education. So again, Deltona is about on par compared to Florida and the nation with the highest numbers of like high school graduates and then associates, and then we're dropping down a little bit with the bachelor's and master's. So poverty levels, Deltona is actually lower than the state of Florida and the United States. 8.4% of people in Deltona live below the poverty line, as compared to 12.3 for the state of Florida and 12.5 for the United States. Even though there are less residents living below the poverty line in Deltona, unfortunately, food security is still high. Deltona is right on par for the state of Florida, which both are at 10.6, and both are slightly higher than the U.S. average of 10.2%. I want to take just a moment and talk about the Florida healthcare system. If you look at this chart on the right, Florida is rated number 28 in the United States for healthcare. So not horrible, but definitely not the best, kind of right in the middle. I guess you could look at it at that. One thing that's interesting, if you look to the left, is a lot of the healthcare system is tied to universities. We've got the University of Florida, UF, Florida State, the University of Miami and UF, and then you'll go into some of your bigger ones, which is like that I've mentioned, Orlando Health, Advent Health. And if you'll also take a look at the map on the left, they're in the bigger cities. You'll see in Jacksonville, you'll see along the coast, Miami, Central Florida, and then if you look over to the top left, around the Tallahassee area. So it's no surprise a lot of the bigger hospitals, universities are in bigger cities. And so, as we'll discuss in just a little bit as well, that's harder for people who live in places like Deltona because it's a little bit of drive to get the health care you need. And, like, for instance, even if you are in a bigger city, I still drive an hour to an hour and a half to see a neurologist that I like and who values my opinion. So, healthcare is a rough topic for everybody. Unfortunately, I think Florida could do better, probably like a lot of other states, right? And but Florida is ranked number 28 in the Florida healthcare system. And as you well know, and what I've heard from a lot of WIC participants is all depends on your doctor. So if you have a good doctor, is at the meat of it, and then obviously we know as well it's going to depend on your education. Before section of data, I want to talk about health statistics, obesity. We know obesity is an epidemic right now in the United States. In fact, 1 out of 5 people are obese. And in 2017, we spent $173 billion in healthcare. related to obesity issues. Deltona is kind of in the middle compared to Florida and the United States. Deltona runs a 39.2% obesity prevalence. Florida is at 37.1, and the United States is at 41.9%, which is going to statistics. It just keeps climbing of how many people are obese in the United States and the epidemic that we do have on hand related to obesity, health-related diseases and issues. Moving on to mortality rates in Deltona as compared to Florida and the United States, it's no surprise that heart disease is the number one killer based on the prevalence of obesity, not only in Deltona, but in the United States. So heart disease is the number one killer in all three areas. It's closely followed by diabetes, which is also related to obesity, and then followed by cancer, which can also, obesity can be a contributing factor to that as well. You also have homicide, and then unfortunately infant mortality is the past 5 to 10 years. The state of Florida, I'm assuming it's like a lot of other states, infant mortality rates are up. People are having babies prematurely. I think some of it is also due to obesity, because a lot of women are struggling with gestational diabetes and preeclampsia. So infant mortality is done because babies are just coming earlier than they're meant to be. And as far as all the numbers, Deltona compared to the state of Florida and the United States is pretty on par with the incidence of death. It's heart disease is number one, followed by a close diabetes, cancer, and then homicide and infant mortality. Before we get into our drive around the community, let's talk about our resources. Volusia County offers quite a bit of community assistance, so we're going to go through them. First, we'll talk about Volusia Helps. It's an app that anybody can download in the county, and it has 13 different categories available for social services. They have housing grants and administrations, which actually helps you find and be able to afford a house in the area. A housing voucher with very low income or disabled residents who need help, who can't pay their rent or their mortgage. And then human services, which is like temporary emergency services, in case of a hurricane or something like that. Library services are available. Obviously, a library collects, organizes, and provides books and additional media to the public. In Volusia County, there's 14 different branches. They offer free Wi-Fi, free computer access, obviously books, and then they have a lot of free community programs as well. I know the library near me, I have one 2 minutes from my house. They do gardening programs, book clubs, that kind of thing. So Volusia County is very similar in that as well. Volusia County offers parks, recreation, and culture. There's arts and public places, cultural activities. There's attractions like the Marine Science Center, a historical site. There's land management that does the ecosystem. Tons of parks, camping, and boat ramps. I pass several every day on my commute. Recreational programs where they offer day camps and seasonal camps like winter break and stuff like that. And then Sports Volusia is kind of like their rec department that most counties do have, where they offer recreational sports and outdoor activities. So the county offers a ton of veteran services. So rather than talk about all of them, I laid them out here, but it goes with a lot of VA assistance that's offered across the United States. Volusia County is no different. Health services. This is some of my favorite services the county offers. They offer clinical services with family planning, immunizations, early breast cancer detection. The dental clinic, I refer at least half of the people that I see to the WIC clinic. It's a great need in our area. Emergency preparedness and response, so special needs shelter. This is actually one of the shelters that I wouldn't say volunteer, but I'm assigned to during hurricanes. Orange City holds for Volusia County the special needs. So anybody for Volusia County would come to our shelter because we have nurses on staff that help them from the county. Environmental, disease prevention, wastewater, indoor-outdoor environments, infectious disease. This is really important, going into the summer and the spring season with mosquitoes and stuff like that, because they can spread. And then foodborne, waterborne illness, and then wellness programs like uh, healthy moms, healthy babies, Head Start, those kind of things as well. Okay, and then to me, community health. This is to me the meat and potatoes of community nutrition, and this involves WIC, SNAP, food pantries, children's service, disabled, homeless, medical, senior, overdose, and tobacco prevention. I'm going to put a plug here. Volusia County got a grant, and there are two vending machines with Narcan now that you can go to. There's no money at all, and you can get it. And so far, it's been utilized at least 10 times, was the most recent number I've had. But there's two like vending machines just for overdose that are full of Narcan. Food pantries, we have about 30 in the area. Obviously, Second Harvest is involved in some of these, but it's a lot of local churches, other nonprofits in the area that we refer some WIC participants to it. SNAP, provides food benefits to low income families. And the heart of where I work and what I do is WIC. And we provide nutrition education, breastfeeding assistance, and financial assistance for healthy foods and healthy formula. Sometimes babies are, as we talked about earlier, they're born premature. Some of them need a special formula. Without the doctor's notes, we can provide these to moms. And some of these formulas are a couple $100s easy because they're specialized to meet the specific baby's needs. And that's where WIC can come in and we can help. I mean, these are people living in, either very low income or low income, and affording milk sometimes is a hard thing to do, much less a formula. That's a couple of $100s for one can. So WIC provides benefits for this, but the most important piece is that we provide the education as well. We're not going to say, hey, your blood pressure is high, I think you should cut down on your sodium. No, we're going to talk about it. Like, here's some foods to avoid, here's some drinks to avoid, here's some things that you can do. And that's, to me, again, is the heart of the community, is being able to provide them like a foundation, like an education on nutrition to help them live a better, healthier life. Okay, let's move on to the community exploration. Remember, Deltona, Florida was chosen because this community has the highest number of WIC participants in the clinic that I counsel at. Okay, so this is the route that I chose, mapping my route. It's weird because it's not really a block per se, but what I wanted to show was how far the neighborhood is from the hospital. So on the very top left, you will see primary care, Halifax Health. That is the closest hospital. And my neighborhood is right in the middle of my route. If you'll look, you'll see the Circle K, the Publix. That right there is my neighborhood, the 32738. That's the zip code. 32725, the second highest, is close by. So this is a large number of WIC participants for the Orange City Clinic. You'll see a few other places that I highlighted, but I did a longer route, and then I in the neighborhood for a while. I spent a whole afternoon actually doing this, going in stores and looking around. But again, I wanted to show you the difference between like the high school and all the way to where the healthcare is. Well, there's also an Amazon warehouse close by, which I'll show you in a minute, but I just kind of wanted to give you an idea. Like, it's a long stretch. From my clinic to the hospital is about a 15-minute drive. It's about the same to the neighborhood that the participants are coming from. So that's just an overview of where I drove and when I went and what I went to see. As I mentioned, I highlighted the hospital. This is Halifax Health. There is little emergency rooms along the way and clinics and stuff like that. But I wanted to highlight this hospital. It's also right by the interstate. So if you had an emergency, this may be one of the closer hospitals to stop as well. It doesn't look too busy. They do have an emergency room there as well. But again, this is one of the hospitals that's closer to the neighborhood. Surrounding the hospital, you see a racetrack. There was also a Wawa, if any of you guys are familiar with that. There's a Panda Express, Burger King, McDonald's, and of course a Starbucks. So lots of fast food right by the hospital. Okay, so I intentionally overboarded this slide because I wanted to highlight how much fast food this neighborhood has access to. Domino's, McDonald's, Burger King, Papa John's, pizza, more pizza, another Panda Express. Me and my husband counted at least five McDonald's on our route. I'm quite sure we missed one or two, but there were at least five when we were driving around, uh, just within like a 5 to 10 mile radius of different places that we went. So lots of fast food, lots of quick food, very little. I think I saw a Greek restaurant and maybe one Jersey Mike's, but as far as like anything close to fresh, that was it. These are your choices. Lots of McDonald's, lots of Burger King, lots of quick food in this neighborhood and for this demographics. I did highlight already one of the major hospitals in the area, but as I mentioned, there are a few other like emergency rooms and like doctors or minute clinics per se. You'll see one for Advent Health. Right in the neighborhood, there was an Orlando Physicians and a Pediatric Associates. And again, you can't be choosy because if you want a pediatrician close to your house, you're going to have to use one of these, and that's pretty much all it is unless you're going to drive. Again, I wanted to go back and highlight industry. It's not part of an assessment for everybody or community assessment, but I feel like it's important to add because there are two Amazon warehouses across the road from each other. And I say that to say, like, these are minimum wage workers. So this is what there are other businesses there too, but like you're getting in this demographic in Deltona, you're getting warehouse workers, you're getting teachers of nurses, you're getting either medium income earners or low income earners. And, if you're in a household of, mom, dad, and two kids, I don't know if everybody's going to work. Everybody's seen the WIC clinic, it's 50-50. So industry is a big part, in my opinion, of a community assessment because you have to know like what are people doing? How much are they making? How are they paying their bills? How are they getting food? Like what are they able to afford? And this Amazon warehouse, actually both of them are right by the hospital that I mentioned, which is right by the Burger King, Panda Express, Starbucks, the McDonald's, the Wawa, and the racetrack. So if you don't take your lunch to work, that's what you're eating because there's nothing else with fast food right there. This picture just highlights the heart of the neighborhood. It's a typical middle, low income neighborhood, double sided. This is just like really flat in the middle of the neighborhood. This is just a quick picture of some of the houses. Honestly, they range. It's a low income, ran down, don't have money to fix it up, beside another one that's nice, new, and renovated. So in one neighborhood, there's different income levels. I live in a different county. I live about 30 minutes from the house if you take the Interstate 45 with the back road. And I'll tell you this, somebody in my neighborhood, all the houses look nice, but I guarantee you there are people living silently in food insecurity. And here's just another picture of the neighborhood. Like I said, some have beautiful green grass, and then their neighbor can barely afford to have grass or have their shades fixed. It's all over the place in neighborhoods like this in Florida. Here's a picture of a few of the schools in my community. On the right, we have the high school, and then to the left, we have one of the private schools. It's pretty close. It was right, I think it was like 2 or 3 minutes from the high school. But the schools are in walking distance. I will say you do have to cross the busier road to get to these, but they are in the heart of the neighborhood, and they're definitely within walking distance. The middle school is gated, so I couldn't really get a picture of it, but I did get a sign. Interestingly enough, there's also like a collection bin right outside the middle school. It looked a little ran down. It seemed decent from what I could see, but I'm not sure. This is right in the middle of the neighborhood, smack dab in the middle of the neighborhood. So it's definitely within walking distance. It is gated, so I'm sure that makes parents feel a little more secure, but I tend to wonder a little bit about the upkeep. I highlighted the Ace Hardware and then Advanced Automotive. There were quite a bit of these stores in the neighborhood and the surrounding neighborhoods as well. My husband, I have to give his due, made a really good point. He said, when you have no money, you have to fix everything yourself. And we're dealing with low income and middle income families, so it makes a lot of sense. We're middle income and we're still fixing our cars and doing stuff like that. So if you're low income and you're looking for grocery money, you're not going to have money to take your car to the mechanics. Or if your pipe busts under your sink, you don't have money for that. So it is very logical, and kudos to him for highlighting the point that I'm just a girl. I never would have thought about, oh, yeah, who's going to fix that sink, or who's going to change that tire or spark plug or whatever it is. You got to do it yourself because there's no money and it needs to be done. So you got to figure it out and make it work. I also found a couple of dollar stores, no surprise, Dollar Tree, Family Dollar. I didn't go in these, but I went in one close to the clinic the other day. They get a bird's eye view, and it's the same thing as usual. Junk food, easy food, quick foods, processed food, because that's what's affordable. These two stores are right on the outskirts of my community in Deltona. It's a Circle K across from a Circle K. Literally, we pulled in one parking lot and I looked across the street and there was another Circle K. These are like any convenience store, candy bars, ice cream. I will say a lot of stores nowadays do have bananas and oranges and sometimes apples. However, they're also, while they're promoting those as healthy foods, they're also promoting gummies and chips in the same bin as healthy foods. And if you look at a pack of gummies, it's like two carbs. It's like 26 grams of sugar. So, there's education behind that, right? Somebody, whoever is setting up a healthy food display is like, oh, yeah, this is healthy. These are fruit gummies. But without that education and with not knowing how to read the label, they don't know. So these are two Circle Ks. On the next slide, I'm going to show you what's across from the Circle Ks. And ta-da, it's a CVS across from two Circle Ks. So I don't know about in other areas, but here in Florida, a CVS and a Walgreens is considered a Circle K. Like a lot of we've lived in two different neighborhoods here, and the CVS was our corner store. I mean, they sell cigarettes, beer, juice, cough medicine, whatever you need. But you have three on one corner, you have three convenience stores that are offering little fruits and veggies, but if you need some milk, you're gonna walk in and go get it and spend the $5 to $10 on, one bag of chips and a gallon of milk because that's what you need. And grocery stores, Publix and Walmart. That's it. In the zip code where I have the most WIC participants, you either have a Walmart or a Publix, and neither are walking distance. Well, they're in walking distance, but I could not imagine walking 15 or 20 minutes to get some groceries and walking back with them. And we'll talk about transportation in a few minutes, but you're limited on your choices. There's no Aldi, there's no Winn-Dixie. Like right at the heart of the neighborhood, if you have to run to get something, you're running to Publix or Walmart, and that's it. Those are your only two options. So I took a look inside the Publix, and as soon as I walk in the door, it's up literally like two steps in the door. It's that whole table of cookies, and then the floral department, which is pretty. But then you also have this section of sodas, beer, pretzels, their BOGO, chips, more beer, and more sodas. So this is right when you walk in. The cookies were BOGO too, so you're just even more enticing. So right when you walk in, your first impression is like highly processed, highly sugar drinks and snacks. Also, in the like Publix did try to do a healthy version, I guess, but even with the healthy version, yeah, you do have some fruit, you've got some smoothies, and then you've got some of the probiotics. So I mean, this is kind of a blend, and then you have wine, you have like salad, cheese, wine. So this is kind of a mix. The problem with this stuff, it's on sale, but it's still expensive. Like this juice drinks are like, they're little juice smoothies. It's BOGO, but you're still paying $3 to $5 for one. So is that in your budget or not? I don't know. It's depend on your own personal budget. So These are some healthier choices, but they're also pricier choices. On the last slide, I mentioned pricier choices, and that's the problem with Publix. Look at all this produce. This is in the same store. It is beautiful. Look at that rainbow, red, green, yellow, pink. I mean, you have a rainbow of colors here, and you've got the color wheel that you should be eating that as a nutrition educator, I tell people to eat. And then I ask, well, where do you shop? And they're like, oh, I shop at Publix. And I'm like, well, why do you go to Publix? And they're like, well, that's by my house. And I'm like, well, Publix is so expensive. And that's the problem. Here is the problem with this community. It's the access that they have to fresh fruit and vegetables is not affordable. Like I love Publix, but I rarely shop at Publix unless it's like a specialty thing I'm looking for because they're unaffordable. Like one apple or a pound of apple at those big apples, if you can see, it's like $2 and I think it's like 59 cents or something like that. That's like two apples. How are you going to feed a family of four with two apples? You're not, because you're not going to get it because it's just too much money. You're just going to skip it altogether. And at the meat of this community, one of the problems is the access to affordable, healthy food. Before I left the store, you know I had to take a picture of the checkout because it's like any checkout, any store, anywhere in America. You've got your chips, more chips. There was some candy on the right too, and then you got all your sodas. But if you look at these are actually like highly processed sugary drinks. Red Bull, those little monster drinks. There's some Starbucks drinks, but they're the ones that are like pre-made with like 5,000 calories. So yeah, you've got to get that last minute buy-in or that last bag from your kids for a bag of chips that you're going to say yes to because it's a one thing that you can say yes to them when you said no throughout the whole shopping experience. Also, when I was also checking out, just in case you didn't get a chance to BOGO some cookies, Little Debbie was also having a BOGO sale. Honey buns, Cosmo brownies, Nutty Buddies, like you name it. And Little Debbie's were also on your way out the door for BOGO prices. I could not find a play area inside the neighborhood that I went to. Like I couldn't find anything. So I Googled it and there is a park right outside the community. It's decent. There's some water, like it is gated, so you can only go certain times of the day. Most of the parks in Florida are like daylight hours. So I'm pretty sure you can probably go from dusk to dawn, but you have to wait for it to be unlocked. So they did have a nice play area, not pictured. It's also a picnic area and then a little tiny another little section of playground. And then, like I said, they do have a body of water that you could probably fish at as well. One nice thing that the park did have, they had this massive basketball court. Well, they had like I don't know, it's probably like six of them, and there were a bunch of kids out there playing. I just took a quick picture. I didn't want to be a stalker, but like the basketball courts were new. You could tell the park's a newer build. The problem with the park is it's a 10 or 15 walk to the neighborhood. When we were coming and going, there was a mom and maybe a friend or a sister, and then they had several little kids that they were carrying, some in a stroller and some carrying. So it's a bit of a chore to get there to start. So there is a park. It does have new nice amenities, but it's not in the heart of the neighborhood where it would be more efficient for people to get physical exercise. I struggled to find transportation. This was a struggle, and I'm an educated person, and I struggled with this. So when we were in Publix, I Googled transportation yet again, and I Googled nearest bus stop. So this is the heart. I'm literally at the Publix in the heart of the neighborhood, and look at all these closed locations. Close, 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 close. Okay, so I'm like, I don't know what to do. I cannot find any bus stops. I can't find anything. So we go to Walmart. We're driving around Walmart. My husband's like, oh my gosh, there's a bus stop. I did not even see that sign. So there are bus stops. Did a little more research. There is an app for the bus stop as well. It's called BoRide. So the problem is a lot of the bus stops that used to be in the neighborhood are not directly in the neighborhood anymore. So you're going to have to walk to the bus stop. Sometimes it may be like a 5 minute walk, but other times it's more of like a 15-minute walk just to the bus stop. Okay, I want to elaborate more on transportation. Transportation is a major issue. The neighborhood, again, where we have the highest WIC participants, is about a 15-minute drive from the neighborhood to the clinic. The bus stop is a 5 to 15-minute walk, depending on where you live in the neighborhood. What are you going to do if it's raining? What are you going to do with an infant? What are you going to do with a newborn? What are you going to do with a 1 year old? So a lot of these moms that come to the clinic come alone. And I've had women tell me, oh, well, I saw a girl the other day. She couldn't get on WIC a few months ago because she didn't have a ride, but her friend was coming today, so she got a ride. I have quite a few that's taken an Uber or a Lyft. So transportation is a major issue. While there is a bus stop, it does not go exactly everywhere that it needs to go. On the right, the bus stop, I mentioned the app is called Bow Ride, but the bus transportation is called Botran. So it's a bigger company. It's not like government owned or local. It's contracted out. So you can get like a bus schedule. And like I said, the locations are kind of limited. When I go to work, I noticed the other day there's more on busier roads. So like if you live in a smaller, less populated neighborhood, it is going to be a trek to the bus stop. So know that. On the right, I wanted to highlight a big point. So, as we have talked about throughout this whole campaign, this whole assessment, my zip code and my community assessment was on Deltona. If you look at the orange map, it's the bus route to DeBary. DeBary, this is all Volusia County. Keep in mind, this is all the same county. So we're going from Deltona to the heart of my neighborhood is where we start on the top right. We're looking at the orange. We're going to go all the way around, all the way to the bottom left, and that is the Sunrail station. That is the closest Sunrail station. Sunrail is a high-speed train that gets you to and fro. It ends in DeBary at the moment, and it goes down all the way to Kissimmee. Why is Kissimmee important? Take a guess. It's Disney. So if you work for Disney and you need a ride, you're going to have to walk to the bus stop, take the bus to the Sunrail, and then the Sunrail to the next location. Luckily, there are closer locations of Sunrail to Disney, but even then, you still may need to take yet another bus to get where you're going. If you're going to downtown Orlando to work, you're going to have to do the same thing. You're going to have to take a walk, a bus, a Sunrail, another bus. We're not even talking about how much money this costs. And transportation is a major issue. It's more understandable after going out and seeing why people don't come to WIC or they lose their benefits or they can't get WIC because you're either coming to Orange City for Volusia County or going to Daytona Beach. And Daytona Beach from Deltona is even further away, like way further away. It's another 20-minute drive when I'm only 15. So you're talking about 35. So transportation is a major issue in the city and for the county. Okay, the Sunrail is great and it can help you get from one place to the other, obviously. The problem is it stops around 7 or 8 at night and then it does not run on the weekends either. So you're limited in the time that it runs, and it also does not cross all the way across Central Florida. So you're limited on where it's going to go to. So the Sunrail can help, but it is also limited due to its hours and location. There are a few taxi services as well as Uber and Lyft available in the area as well. But again, you got to have the money to pay for these. And you got to have a working cell phone. Okay, strengths and weaknesses. Strengths are close access to food, close proximities to school. All the schools were within walking distance, environmental resources, and the average drive to major cities like Orlando, Kissimmee, and Daytona Beach is about 30 to 45 minutes, depending on exactly where you're going. But the average commute time in Central Florida is pretty consistent with the state of Florida. I did look these up. They're about 26 to 35 minutes. Obviously, 30 minutes is an average drive time. And so it was consistent here as it is with the state. So that's good. Weaknesses include limited grocery stores, high priced food selections, transportation, limited surrounding health care, and then park proximity. For environmental resources, what I mean is you have Florida is, and I'll go into detail in a second more, loaded with water. So you have lots of just like natural springs, natural parks, the beach. You have a lot of resources like that. Where you're limiting on the flip side of that is actually like when you have young kids, like parks to play in and stuff like that. The one flow, and this is typical in a lot of Florida communities, is the problem is you will have a two-story beautiful house, well manicured lawn right next door to a house that needs a new roof. The car's broken down, windows are busted out. Like the socioeconomics are not always consistent throughout the neighborhood. And Deltona was an iconic classic of this. It was the economics were all over the board, the socioeconomics. Like some were you could tell they had probably bought a fixer upper and had more than enough money, and it was beautiful. The lawn was taken care of, and just everything was perfect about it. And then you look at their neighbor, even two or three houses down, and they look like they could barely afford anything, and there was trash in the road, and just really just broken down. You could also tell about this neighborhood I found that was interesting, and honestly, it's probably a strength and a weakness, is a lot of people own small businesses. You could tell by the trucks and the trailers that were out there, a lot of construction workers, plumbers, like it's that middle class, iconic, upper to low class. Like you work with your hands, you develop a trade, and it was really evident in Deltona in this community. And honestly, that's a strength and a weakness. It just it varied throughout the neighborhood. Um, Okay, to give you a little more background, Deltona is closer, it's in Central Florida, but it's closer to the coast. So it's closer to the beach. Additionally, why here? When I said environmental resources, while you may not have a playground in your neighborhood to take your toddlers to, there are so many natural springs in the Deltona area, really in Central Florida. But if we're only focusing in Volusia County, you have Gemini Springs, you have Blue Springs, you have Ponce de Leon Springs, you have another state park. And here's a few of the springs. And this is Gemini and I want to say Blue Springs. Blue Springs is like really popular for to see the manatees. So that's really cool. The other park was Green Springs, and I want to mention a lot of these parks they are ran by the government. They're state parks, but the parking like to get in for a family to spend the day is like $3 to $5. Where I live, we have Wakaiva Springs, and it's like $5, and you can spend a family's go and they spend the whole day. They have picnic tables, they have grills, so you can go and literally just spend the cost of food and spend the whole day enjoying your day. And this one's actually Green Springs. So just in my zip code close to it is Green Springs, Blue Springs, and Gemini Springs. And I mean like a 10 or 15-minute drive from the location. That's it. And I mentioned the beach. I mean, that's a great thing about living in Florida. To me, this is Flagler Avenue. It's a New Smyrna beach. It's really popular, especially for the high school kids. But it's like 25 minutes from Deltona. This is another environmental resources. Some people complain about the cost of parking, but it's a couple of bucks. You have the whole day. Again, this is as long as you have a car, but as long as you have the transportation, there are these natural resources that make this such a good place to live and stay and play. And I mean, I only talked about a few springs, I talked about the beach, but there are so many other lakes and waters that people, they go on boats, they go fishing. Like a lot of communities can walk, 10 minutes down the road and fish in a pond. So there's a lot of natural resources that's available in this area. While there may not be built environments like I've discussed, which is a weakness because you have little toddlers. Sometimes it's easier to just walk in the neighborhood. On the flip, you have the environmental resources that are mostly free or very affordable for families. Okay. We're having a little discussion, opportunities versus threats. First of all, I want to say I love this picture. My husband actually spotted it when we were driving around. We had to turn around and look at it. And I like it because it represents the community, right? These are hardworking people just trying to live a good, healthy, and happy life. They want to be in a state of mental and physical well-being. And I think this is just a good representative of like, this is the community that I work in and people live and play in. And so it's just a great analogy to sum it up. So, Opportunities versus threats. Opportunity, more built environment for play. There are some resources, tons of, like we just discussed, tons of environmental resources, but we need more physical incentives, more, programs to help get kids off the couch. There's a large percentage of kids that are now overweight and obese, and we need to create more programs and playgrounds to promote healthy well-being and really just physical activity. This age is an age of screen time. It's all about your iPad, your iPhone, your Android, whatever it is. It's a lot of kids have a sedentary lifestyle, and Volusia County, this demographic of Deltona could use more active play, more programs to promote play, free programs, because, right, even if you do a rec or like upward, like a private program in a park, you're still spending $50 to $150. So we need free programs for the kids get involved, and we need more playgrounds for kids inside the neighborhood to play on. You know what? On the playground at the elementary or the private school, make it accessible for certain times of the day for families to walk down to on the weekends and play. It's an easy thing to do. So that's one thing. We need more built environment. Second opportunity is access to affordable food. The grocery stores that are close to the neighborhood are really expensive. You're having trouble paying your water, your rent, your utilities. Like, it's a really hard time right now. Eggs are $5 for a dozen. It's basically, 75 cents to a dollar for one egg. So, and then I'm always wondering how people only eat one vegetable a week. And then I drive to the neighborhood and I saw it's just Publix and Walmart. And now I know why people only eat one vegetable a week, because it's not important to them. What's important is getting food on the table. So there's an opportunity to figure that out, offering a fresh food truck, a farmer's market, like in the neighborhood, anything, a neighborhood garden. There's lots of resources that we can utilize, and a garden and a fresh food truck from a local market, not a market, but like a farmer's market, like a local farm. Hey, every Saturday from 2 to 5, me and whatever, we're going to drive around the neighborhood, or we're going to be set up here where you can walk and get affordable fresh foods. And it's like right off the back of the truck. Gardens are also a great opportunity. And with the schools in the area, that should be an easy program that you can launch with a science class. When I worked for Subaru, that's something that we did. We sponsored a garden at a local school. So, there's always ways to work with your community partners and get donations like soil and plants donated, so that the kids can learn how to garden. And you and I both know that people, especially kids, are more likely to eat foods that they grow and prepare and cook. So it's also a way to get kids introduced to more fruits and vegetables. Resources. Are resources being met, and are they available? Absolutely. I will say I've only been with Volusia County for about 8 months, and through this assignment actually have I learned about the resources. So is all the needs getting met? In my opinion, probably 90% yes. If you have housing issues, we're going to give you a voucher. If you need help with your mortgage, or finding a mortgage, or finding affordable help, Volusia County is going to help with that. If there's a hurricane, we're setting up shelters, or any kind of natural disaster. Heat strokes, when the temperature is too hot, we're setting up shelters. So it's going all the way around. So there's emergency services for whatever people need. Like I said, Volusia Helps is an app that any Volusia County resident can get, and it connects you with the resources. So you put in what you're looking for, and it helps connect you. The library, if you need help with school, most schools have tutors, but then you can also go to the library. There's books, there's computers. Like, if you can't afford a computer at home, you can go to the library. There's free Wi-Fi. Maybe your Wi-Fi is cut off or you don't have it, you can go to the library. Parks, camping, boat ramps, rec, sports. We've talked about these. There are some available, but again, they need to be free sports available for kids. And then veteran services, those are on point. They're available for all veterans, and I think they're pretty comparable to the state and the nation's average with offering those. My strength is what's available with WIC services. One opportunity is to to provide like rideshare apps or, a bus ticket, or let us, on every Wednesday, if you need a ride, we're offering Lyft. I'm not sure how you can work that, but there's an opportunity to get people to the WIC clinic, or maybe and SNAP, and maybe you do it the other way. You go out into the community. Okay, WIC and SNAP representatives are going to be, at the Publix in your zip code from 10 to 2 every Wednesday, whatever it may be. But sometimes if the community doesn't come to you, or they can't come to you, then you need to go to the community. And through all of it, I feel like that's the biggest opportunity. Take your WIC officials out, take your SNAP officials, take your farmers out, take everybody out and go into the community and be like, okay, I'm here. How can I help you? Here's the services. I brought them to you. Now let's work together. It's the same with the food pantries. Most people don't even know what food pantries are, or they're too humble. I tell people that struggle, it's one of the questions we ask at WIC: ask for help. Put your humility aside. We all struggle with different things in our lives at different times, and food pantries are there. And maybe it's also getting them out. We're able to help with homeless, medical, senior. Volusia County has lots of resources. I mentioned the Narcan for overdose, tobacco prevention. I'm actually going to go to a program starting the whole month of April where we're trying to help people quit smoking. It's with the community program for Volusia County, but it's a smoking cessation program. And then disability and people that struggle. As I mentioned, all our shelters are catered around these. I've had people that struggle to pay their power bill. I have somebody, like, I don't know how much they can help you, but let me give you the contact information. Clinics, dental. Dental is a big issue in Volusia County, and the county has met the need, and it offers clinic. The clinic takes Medicaid insurance. They will also take you with no insurance with an emergency. They're going to get you in and help you. So this clinic in this county does a great job of accessing a lot of threats and over jumping those barriers to make sure that people have access to this. And the biggest opportunity for any hurdles that the county does have in the zip code in Deltona, Florida, is for more resources to come out of their hiding and go into the community and say, here I am, let's work together. I created two PES statements for this assessment. The first one is the target population is at risk for overnutrition related to lack of access to affordable healthy foods and lack of built environment to promote exercise, as evidenced by data and built environment. Additionally, target population is at risk for overnutrition related to a lack of nutrition knowledge, as evidenced by diet histories obtained in the local WIC clinic. So to me, these diagnoses correlate to two things in the dietary guidelines. The first one is focused on meeting food group needs with nutrient-dense food and beverages that stay within calorie limits, and then limit foods and beverages high in added sugar, saturated fat, sodium, and limit alcoholic beverages. So because this community does not have the needed access to nutrient-dense food, they're consuming foods higher in added sugar, fat, and sodium. So these two go hand in hand, and both of these are not being met adequately in this community. These are my resources. Thank you for taking the time to watch my community assessment. I hope that you were able to learn more about the city of Deltona and the great state of Florida.